The purposes of this film are, first, to illustrate the unique and isolated setting in which ALS is so prevalent. Secondly, to demonstrate that clinically and pathologically the disorder observed is a classic form of ALS. And lastly, to point out that the familial incidence on Guam is extremely high, contrary to the reported experience elsewhere. These are some of the patients who reside within a few miles of the hospital. All will die on the average in 3 years, for there is no effective treatment. Gradual progressive weakness and wasting of the limb or bulbar musculature was the usual mode of onset. All patients had muscle weakness and wasting. Most demonstrated upper motor neuron involvement as well. Clinically, this was noted as spasticity and extensor plantar responses in lateral sclerosis, and as dysarthria, dysphagia, sucking reflex, or poor emotional control in pseudobulbar palsy. If atrophy was severe enough to mask signs of pyramidal tract involvement, the patient was said to have progressive muscular atrophy. If bulbar involvement was prominent initially, the patient was said to have progressive bulbar palsy. Several typical patients will be shown to demonstrate the usual neurologic findings or other interesting features of the disease. This patient is a 46-year-old housewife who demonstrates the findings of classic ALS. This film was made 27 months after the typical onset of progressive muscle wasting and weakness in the extremities and progressive difficulty in speaking and swallowing. The marked atrophy in the muscles of the hands is evidence of the effect of the anterior horn cell degeneration in progressive muscular atrophy. Weakness and wasting of the tongue indicates the effect of progressive bulbar palsy. Ocular muscles are not affected in this disorder. A positive sucking reflex demonstrates the involvement of corticobulbar fibers in pseudobulbar palsy. Huffman sign and hyperreflexia are noted. The Babinski sign demonstrates bilateral pyramidal tract involvement. Röntgenograms of the head and neck, blood Wassermann, and spinal fluid examinations were normal. The patient's sister, nephew, and cousin had died of ALS. A biopsy was obtained from the right deltoid muscle. A cross-section shows a group of centrally placed atrophic muscle fibers in a fascicle of otherwise normal fibers. This picture is compatible with chronic muscular atrophy. Here the patient is bedridden and mute and has considerable difficulty in swallowing. Skeletal muscle atrophy has increased. However, as in all patients studied, there is no sensory disturbance, nor are the bladder and bowel sphincters involved. The patient's intellect remained unaffected. A few weeks later, as a result of inanition and aspiration pneumonia, the usual cause of death in these patients, she died, and necropsy was performed. H&E stains of the spinal cord, as seen on 3 successively higher magnification views, showed in the anterior horns an almost complete loss of neurons.